Sjogren's disease, also known as Sjogren's syndrome, is an autoimmune disorder in which the body's immune system mistakenly attacks its own healthy tissues, particularly the glands that produce moisture. It primarily affects the salivary and lacrimal, tear glands, leading to dry mouth and dry eyes, respectively. Key features of Sjogren's disease: 1. Dry eyes, keratoconjunctivitis sicca, a burning or gritty sensation in the eyes due to reduced tear production. 2. Dry mouth, xerostomia, difficulty swallowing, talking, or tasting caused by decreased saliva production. This can also lead to an increased risk of dental cavities and oral infections. 3. Fatigue, generalized tiredness, and exhaustion are common. 4. Joint pain. Many patients experience joint pain, stiffness, and sometimes swelling, similar to rheumatoid arthritis. 5. Systemic involvement. In more severe cases, Sjogren's can affect other organs, such as the kidneys, lungs, liver, and nervous system. Types. Primary Sjogren syndrome occurs on its own without any other autoimmune disease. Secondary Sjogren syndrome occurs in association with another autoimmune condition, such as rheumatoid arthritis or lupus. Causes. The exact cause of Sjogren syndrome isn't fully understood. It is thought to involve a combination of genetic, environmental, and hormonal factors that trigger an abnormal immune response. Women, especially middle-aged women, are more likely to develop the condition than men. Diagnosis. Diagnosing Sjogren's syndrome can be challenging as its symptoms overlap with many other conditions. Diagnosis typically involves blood tests, checking for specific antibodies, e.g. ANA, SSARO, SSBLA. Schirmer's test, measuring tear production. Salivary gland biopsy, examining tissue for signs of inflammation. Imaging, sialography or salivary gland scintigraphy to assess salivary gland function. Treatment. There is no cure for Sjogren's syndrome, but treatments focus on relieving symptoms and preventing complications. Artificial tears and saliva substitutes to relieve dryness. Medications, including anti-inflammatory drugs, immunosuppressants, or biologics, depending on the severity. Lifestyle modifications, regular dental care, staying hydrated, and using humidifiers can also help manage symptoms.